Hi dear doctors, welcome to Kidscovery. Welcome to the class of Pediatrics. I am your pediatric faculty and the topic of discussion in today's class is the Common Variable Immunodeficiency. Okay, so Common Variable Immunodeficiency means, again, it's an autosomal disorder which is going to affect the B cells. It's also going to affect the B cell differentiation, and since the B cells are not getting differentiated, it results in low immunoglobulin levels. Okay, in low immunoglobulin levels. So pathophysiology, you have to understand, like if the B cells are not differentiating, of course there will be less amount of immunoglobulins. Since it's a autosomal disease, remember both men and both women are going to be affected in this case. And one thing which you have to understand is that because immunoglobulins are not formed, so the child is going to have all the infections, primarily the respiratory as well as gastrointestinal tract infections. Okay, so the important part which is asked actually, like in CVID, common variable immunodeficiency, which is the pulmonary manifestation which is seen, it is actually the bronchiectasis which may develop due to permanent damage to the bronchus. Okay, now CVID can be diagnosed when defective antibody is demonstrated. Now understand, we can be short with this diagnosis when we see the defective antibody. Okay, so how to demonstrate this defective antibody? Low immunoglobulin levels, okay, poor vaccine response. So actually, if you know very well that vaccine is something which is given to increase the amount of immunoglobulins, and since the immunoglobulin formation is hampered in this case, that's why vaccines are also not going to give you some immunity. So poor vaccine response, and of course the CD4 to CD8 T cell ratio is going to be decreased. Now there is a condition which is called as X-linked Hypogammaglobulinemia. So it's actually a X-linked condition, Hypogammaglobulinemia. So as the name is suggesting that there will be no gamma globulins, so the immunoglobulins are going to be very less, Hypogammaglobulinemia in this case. So what is going to happen? See, understand one important part that X-linked Hypogammaglobulinemia is not going to have even the B cells. Okay, so whenever you will perform a peripheral smear, you will not have the B cells in X-linked Hypogammaglobulinemia. Okay, so whenever you will perform a peripheral smear, there will be no B cells which will be there. But if you talk for your CVID, of course B cells are going to be there, but B cells are not going to divide. Okay, they are not dividing, although they are going to be present. Okay, so similarly, this is what they have written, that X-linked Hypogammaglobulinemia presents mainly with similarly to the CVID, but it also shows an absence of B cells on peripheral smear. So what to do? We have to give the immunoglobulins from outside. So start giving intravenous immunoglobulins to prevent the recurrent infections. And sometimes what happens in this case is, like because the B cells differentiation is not happening, it can sometimes cause recurrent infection. So these recurrent infections can sometimes I should explain like this, that because recurrent infections are happening, your immune system is so active that it can start killing your own cells also, and that is known as autoimmune. So we have seen this autoimmune complications happening with the common variable immunodeficiency, namely your autoimmune thrombocytopenia and hemolytic anemia. So anemia and thrombocytopenia is something which is there. So what to do in these cases? We have to kill the spleen. We have to do the splenectomy so that no more killing is going to occur. Okay, no more killing is going to occur of your RBCs, of your platelets, because of course these things are going to get killed in the spleen only. That is called as graveyard. Okay, so that's why we kill the spleen itself. But the important question is, whenever you are going to do splenectomy, which is the vaccination which you are going to give? So just remember SPLEEN. So N for your Neisseria, S for Streptococcus pneumoniae, and I think by now from your microbiology class also, you know that Haemophilus influenza and Streptococcus pneumoniae are very similar. So whenever Streptococcus pneumoniae comes, Haemophilus influenza has to come. So this is the end of my lecture of CVID. Thank you so much for watching.